Hello everyone, warm welcome to the orientation session of March 2024 exam batch on behalf of whole Elite Expertise team. Myself, I'm Rekha Anubrolu. I am an admin manager of Elite Expertise. I'm a BPharm graduate. I have finished my graduation back in 2016, and then I have done my master's in public health from Torrens University, Australia. So I'm one among the KAPS qualified candidates. I have cleared my KAPS in March 2023 exam, and I'm one of the proud student of Mrs. Harika Bheemavarapu and Mr. Arief Mohammad. I have cleared my KAPS exam under their guidance. Not just me, there are more than 500 students who have cleared KAPS exam under both sir and ma'am's guidance. So today, yes, here we are for the orientation session for March 2024 batch. So let me introduce Elite Expertise, what we are and what are the courses we provide. So Elite Expertise, we are an online education platform founded by Mrs. Harika Bheemavarapu and Mr. Arief Mohammad with the mission of giving quality education as well as practice-based knowledge for aspirants who are planning to migrate to Australia by clearing KAPS exam. So our courses range from KAPS, Knowledge Assessment of Pharmaceutical Sciences, Intern Pharmacist Written Exam, as well as Intern Pharmacist Oral Exam. So we are also planning to launch pharmacist licensing exams for countries like Canada, UK, USA, as well as Ireland. So we are upcoming with those things as well. So let me proudly introduce our director, Mr. Arief Mohammad, an ocean of knowledge. So Mr. Arief Mohammad, he's the director as well as educator of Elite Expertise. He have done his graduation from India. He have done his graduation in Bachelor of Pharmacy as well as a master's in clinical and hospital pharmacy from India itself. And he have worked as a lecturer in Malaysia for 3 years and then decided to migrate to Australia. In 2017, he successfully migrated to Australia by clearing KAPS exam, and he started his pharmacist career in Australia. So since then, he have been serving as a pharmacist and gained experience over 6 years in both community as well as hospital sector. He started his career by doing internship in a community sector, and soon after finishing his internship, Sir has started his journey in a hospital as a clinical pharmacist. Currently, Arief Sir is working at Northern Health as a clinical pharmacist. It is a well-known healthcare provider in Australia. Not just this, he's also an accredited consultant pharmacist. He's a member of Pharmacist Immunizer in Australia and a member of Society of Hospital Pharmacists in Australia. Arief Sir has established teaching career of training more than 500 students for KAPS exam. So I happily welcome Mr. Arief Mohammad to take over the session and have a talk with our aspirants.
Thanks, Rekha. Thank you so much. And good evening, guys.
Good evening, sir.
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 Yeah,
Good evening, sir.
Yeah, good evening.
Come on, sir.
Yeah,
Good evening, sir.
Good evening, sir.
Good evening, and nice to see you all. So, myself, my name is Arief Mohammad, and I'm one of the directors and lecturers at Elite Expertise. So, currently, I'm working as a clinical pharmacist in Northern Health Hospital in Melbourne. So, my journey regarding this KAPS pathway is I did my KAPS in 2017. And after clearing my KAPS examination, I moved to Australia and started working as a pharmacist. And after working as a pharmacist, then I realized that I need to move forward. Like I need to improve myself in my career. So I did a course known as the accreditation course. Okay? Then I became a consultant pharmacist, and then later, actually, my passion was to work as a clinical pharmacist in the hospitals. So, and then later, like within 1 year, I found a clinical pharmacist position in the hospital. And then since then, I have been working as a clinical pharmacist in Australian hospitals. And currently, I'm working at Northern Health Hospital in Melbourne. Okay. So this is about my KAPS journey and my current pharmacy practice journey. And regarding this KAPS, like there was a myth that most of the candidates, they think that this KAPS examination is much tougher exam, but in fact, it is really a bit tougher exam. Okay, so it is really a tough exam because I came across a lot of the candidates before I started this training and so on. So I came across a lot of candidates who I met in Australia, and they told me that they did their KAPS examination and they were unsuccessful in their first attempt, second attempt, third attempt, and finally they gave up they gave up the KAPS pathway, and they were doing some masters and other courses here in Australia. Then later on, like since 2017, most of my friends, they approach me to give some advice regarding how to prepare for the KAPS examination. So since then, I have been developing some new methods. Okay? And also I have been studying a lot and trying to concise the content and try to prepare a good syllabus for the KAPS aspirants. Okay? Then finally, I have started doing this training. Okay? And till now, I have helped around more than 500 candidates in clearing the KAPS examination in their first attempt. And this year, we have started our own platform, that is the Elite Expertise platform. And after starting this platform, in the first batch itself, we are so glad to announce that we got 90% of the success rate in the first batch of Elite Expertise. Okay? So the first batch is nothing but the exam which was held in July this year. It was the first batch for Elite Expertise, and the success rate was 90%. And after that, even for the November batch examination, so November exam was held this week, the last week, and we are so confident that even for our November batch, we will get the same percentage of the result. Okay, so we are confident of that. Okay, and we are also confident that even for the March batch, okay, I will make sure that all the candidates will get the same percentage of the result. Like all the candidates will pass the KAPS examination in their first attempt. Okay, so that is my that is the goal or the aim of Elite Expertise. The way that we teach, to make sure that all the candidates, they pass their KAPS examination. So especially I believe that credibility of any educational institution, it may depends on the quality of education that the institute provides. And this quality of education, it mainly depends on the responsibility of the teachers or the responsibility of the lecturers who teach the students. So that's how Elite Expertise is different from other institutes, those who are giving the trainings for the licensing examinations. So at Elite Expertise, myself and the other lecturer, Mrs. Harika, we both are clinical pharmacists. So we are currently working and we are practicing pharmacists, and we both are clinical pharmacists and accredited pharmacists in Australia. So we always try to provide a concise method of teaching, okay, where at first we learn ourselves through our practice. Okay, so we learn a lot through our practice, and the same thing that we teach to our students. Okay? And at Elite Expertise, like we believe, especially that the teaching concepts is much important for the students. So we mainly believe in teaching the concepts. So from basic things, we keep on teaching in each and every lecture, we just keep on teaching the basic things, from basic things to the complicated things in our lectures. So because if the candidates, if they are thorough in the concepts, then in the examination, whatever be the way that the examiners, they try to twist in the questions, if you are good at the concepts, then you can answer the questions. It doesn't matter how hard you get the paper. So you will clear the exam in your first attempt. And that is the main target, or that is the main goal of Elite Expertise, okay? To make sure that each and every student will need to pass the examination. And as at the beginning, Rekha has given the introduction that we at Elite Expertise, we not only give the training for the KAPS examination, but also we train for intern written examination as well as the oral examination. So intern pharmacist oral examination is the last step, but it is one of the most challenging steps, okay, because a lot of candidates, they fail in that examination. We also train for that examination to make sure that you get a full license and become a fully registered pharmacist in Australia. And apart from that, soon we are also launching the other licensing pathways as well, like for the NAPLEX for US, Canadian PEBC, as well as for UK and other countries as well. Okay, so these are our next targets that we are going to launch at Elite Expertise. So guys, let me share a few things about Elite Expertise. So at first I will present my slide. So I hope everyone can see this slide.
Yes, sir.
Okay, thank you. Thank you so much. Okay. So already we have provided the complete schedule for today, that how we are going to organize this event. Okay. So at first I will discuss about the few things about Elite Expertise, that what programs that we are going to do, like especially for this KAPS examination, what we are going to plan and so on. Okay. And after that, you will be having a presentation with one of our chief guests. Her name is Sherri Barden. Okay. So she will give a presentation on asthma as well as the hay fever. She's not going to explain in detail about the complete management of the disorders. Okay? So just she will give you an overview of management of asthma as well as the hay fever. Okay, so that is that presentation will start at 7 p.m. and it will be for 30 minutes. Okay? And after that, I will continue explaining about the KAPS examination syllabus as well as the KAPS examination scoring, that is how much score that you need to get and what are the strategies that you need to follow to clear this examination. Okay, so these are the things that I will continue at the end. And also at the end, once I finish those things, then there will be a Q&A session, and during that session, if you guys have any questions, then you can ask me. Okay, so let's begin with our Elite Expertise. So myself, Arief Mohammad and Harika Bheemavarapu, we both are the founders of Elite Expertise. So we started Elite Expertise, which is an online training platform, in June 2023. And as we got the first batch result, and with the success rate of 90%, so 90% of success rate is like we got 90% success in the first batch that was held in June exam. Okay. Sorry guys, just a moment. Okay, I'll share the slide again. So I hope everyone can see this slide now. Thank you. Okay, so this is our website. Those who haven't visited our website, so please visit our website and you can know more about us. Okay, so what are the courses that we have, as well as you can know about our team, as well as the testimonials. And also the specialty at Elite Expertise is, this is the only like education center, like which provides the licensing examinations, training for the licensing examination. So where we transparent, we are 100% transparent. That is, even all the exam results that we publish it in our website. So after getting the exams result, we will publish in our website, and you can, and it is open for everyone. So anyone can go and visit to our website and you can see our exam results. Okay, with our official KAPS APC letter and so on. So everything that will be in our website. So this is our pass percentage for the July batch. So we got 90%. And once again, I would like to congratulate to all the students, those who have cleared their licensing examination, that is the KAPS exam in July 2023. And we are still waiting for our November batch exam result. So once we get the November batch exam result, then once again, we hope, like we are sure that our students, even for the November batch, everyone will clear with flying colors. Okay, so we are just waiting for the day of the result. So once we get the result of the November batch, then once again we will publish it in our website. Then for the March 2024, we are planning to do something like different activities as well. Okay, so like for the November batch, already we have started implementing few new activities in our curriculum. So at Elite Expertise, we take the live lectures. Okay, so weekly there will be around 4 or 5 live lectures. So we provide the complete schedule for you according to the timetable. So you need to attend to those live lectures. So live lectures will be taken by myself as well as by ma'am Harika. So we both take the live lectures. And we know that most of our students, they are from worldwide. They are all are working professions, and they are from different countries. Few of them are from Canada, from UK, from Middle East, as well as from other countries, from African countries as well. So we all have a different time zone. So it is not possible for all the candidates to attend the live lectures at the same time, because in those who are in Canada, for them it will be at midnight by the time when we are taking the lectures here. For those who are in the US, the same thing, and also in other countries as well. So it may or may not be possible for the candidates to attend the live lecture. So at Elite Expertise, we also provided the recorded videos. So what we do is, once the live lecture is going on, we'll do the recording, and that recording or the recorded video, we will provide it in the folder. And whenever that you have the spare time, then you can go and visit and you can watch those videos, and you can repeat those videos, or you can watch those videos multiple times. And we also have the mocks, the Elite Expertise mock test. And the specialty of this mocks is, so the mocks for Elite Expertise, we mainly conduct on pro-profs. Okay, so you can do the mocks on the pro-profs. So these mock tests are nothing but they simulate similar to that of your final examination. So it is a timer-based test, okay, and exactly it will be similar to that of your final examination, that how you will take your KAPS exam. Okay, so we have more than 15 or 16 mocks till now, and also we have the grand test. And what we'll do is, at Elite Expertise, for each and every batch, we'll keep on updating the mocks. Okay, so the mocks that you have done for the last batch, the same questions won't be there in this batch. Okay, so we'll keep on updating our mocks. We'll keep on adding the new questions. Okay, so these are the things that we keep on doing for each and every batch. Okay, and we also provide the handouts. Okay, so complete handouts, like all the lectures, that whatever that you have learned during the lectures, and everything that you can see in the handouts as well. And for every batch, we'll update the handouts as well. Okay, so we'll keep on updating the handouts. And apart from these things, we also provide the assignments. So assignments plays a major role here. So this is the new thing that I have started from the last batch, that is by providing the assignments. So like this is the sample of the assignments. Like all the questions in the assignment, you need to answer in 1 or 2 words. Okay, you need not to, for assignments means most of the candidates that they think that they need to write a big essay, or they need to write everything about those medication or about that disorder, but it's not like that. So there will be a question, I will provide you the question, and you need to give the answer for that question only in 1 or 2 words. Okay, so just in 1 or 2 words, you need to keep on giving the answers. And till now, there are assignments for the important topics. So the important topics in the KAPS examination are One is for the cardiovascular system and the other is the nervous system. So these two systems, they play a major role because you can expect a lot of questions from these two topics itself, because they both are the vast, they both are the very big ones. Okay, they cover a lot of medications in cardiovascular as well as the nervous system. So till now, I prepared the assignments for cardiovascular and the nervous system as well as for the respiratory. But for the March batch, okay, so I'm still going to prepare the new assignment topics as well. Okay, so these assignments, they play a major role, especially they help a lot for the candidates to a day or like 2 days before for a quick revision. Because here in these assignments, you will be having the question and you will work out by yourself and you will note the answer for that question. But once you finish these assignments, in the next live lecture, I will discuss the answers for those assignments as well. Okay, for all the questions. So answers will be discussed in the next live lecture. And during that live lecture, so you can note down the answers for all those questions. And these questions, it becomes much important, especially all the questions that we prepare for this assignment topics. They are nothing but they are the core important points from those topics, the core important points from the nervous system, important points from the cardiovascular system. Okay? And you will have the answers for those questions with you. Okay? And it becomes a quick revision for you, like 2 days before the examination. So this is the one that we have started, like providing the assignments to our students. Okay, and for the March batch, I will increase the number of assignments as well. Okay, for the other systems, for other topics as well, we'll start providing you the assignments. And apart from these assignments, there is another thing that is nothing but we will provide the case studies. Okay. At Elite Expertise, whatever be the things that we teach them in the form of a case studies. Okay. So there have been like more than, till now, there are more than like 30 or 40 cases that we have discussed in the lectures. Okay. So it is nothing but whatever be the concepts that we teach, we try to make them in the form of a case scenario. Okay, that is how we see the patients in our real life. Okay, so when we go to the hospitals and from our practice skills, okay, so we'll try to prepare the case studies, and those case studies will be discussed with all the candidates in the live lectures. And these case studies is nothing but it gives a complete overview of what you have learned in that topic. Okay, so in that case study, like we design the case study in such a way that all the important things will get covered in one single case. Okay, so that you will learn all the important things from those case studies. Okay, so providing the case studies is another important thing that we do for you. Okay, and the other one is the new activity that we have introduced is nothing but a team push activities. So team push activity is nothing but it is the activity where all the other team members will push you to submit your assignments and to do your all the other activities like your mock. And if you have been given any case study and if there are any questions to solve, then all the other group members will push you to do that things. Okay, because here the criteria is like we divide you in 4 groups, like group A, B, C, and D. Okay. And in each group, there will be like 20 students, depending on the number of students. It can be 20, 25, okay, or maximum up to 30 students. Okay. Let's say, for instance, if one of the students, if they are not active, okay, and if they are not doing their assignments or if they are not doing the keywords. So here keywords, collecting keywords is nothing but, so from the last batch, I have started a new activity that is, I will ask the candidates to write the keywords from once I finish the lecture. So after finishing the lecture, immediately the candidate's responsibility is to go and watch that recording and note down all the important keywords from each slide. Okay? So they need to note down all the important keywords. Okay? And these things like collecting the keywords, they must do, everyone must do for each lecture. Okay? And they must do right from the beginning till the end of the training. Till the end of the training, in the sense, for the last lecture, that is nothing but the revision based tests or the revision based classes. Okay, so till then you guys need to keep on collecting all the important keywords from each topic. Okay? And these keywords, they play a major role, especially if you have collected all the keywords from each topic, from the cardiovascular system, keywords from respiratory system, keywords from nervous system, keywords from all the other endocrine system, and so on. If you have all those important keywords, then you can just quickly revise, like 2 days before the examination, you can quickly revise and you can recall all the whole topic immediately in your brain. Okay, so these are the important things that you need to do. And I know that like it is like most of the candidates, they try to skip doing the assignments, as well as skip doing collecting all the keywords, as well as skip doing or giving the answers for the case studies. Okay? So these are quite things that happen. So that's why there is an activity which is known as the team push activity. Let's say, for instance, if there are 20 members in the team, in team A, okay, so all the 20 members, they need to submit their individual assignments. They need to submit their individual keywords, and they need to submit the answers for the individual case studies. Okay. So let's say, for example, if I am a bit lazy, I'm one of the members in the team, and I'm a bit lazy, and I'm not doing the assignments, and I'm not collecting all these keywords, and I haven't done the case studies. Okay, so if I postpone it to the next week, if I think that, okay, so this week I got some other activities or other things to do, so if I think that I can postpone it till the end of this month, okay, so such things, it won't happen, because if I won't submit my assignment, and if I won't submit my keywords, my collected keywords, okay, then all the other team members also, they can't submit. Okay, because here there is a interconnection, that even if one candidate fails to submit, then all the others, they can't submit it. Okay, it means that they will keep on texting you, they will keep on messaging you, what happened, when will you submit? Okay, please submit it as soon as possible, because of you, all the other candidates in the group, okay, we are just waiting for your submission, otherwise we can't submit our group report. Okay, so these are the things that occurs. So they will keep on pushing you, so that automatically, when you are in a group, when you are in a team, definitely, even if it is still midnight, like 1 a.m. or 2 a.m., you will sit and you will finish that task. Okay, so these are the interesting things that we have introduced. Okay, so and yeah, as I mentioned, that without doing these things, no one can submit their assignments. Like all the group members, they can't submit their assignments as well as their own keywords. Okay, so, and at Elite Expertise, we do have the Elite Expertise app, as well as like we have the app for Android as well as for iOS and for the Windows. Okay, so you guys can log into the app, and you can visit to like you can go to the KAPS examination, because you are preparing for the KAPS. Okay, so you can go to the KAPS examination, but you won't have the access for the oral as well as the written examination. So you'll be having access to the KAPS examination, where you can find all the videos up over there. So once we finish the lecture, all the videos will be there in the app, so you can go and watch those videos as many times as possible. And also all your assignments, okay, and your other activities, that whatever that I have discussed, like collecting the keywords and so on, all these assignments and the activities, everything, that once you finish, you will be having an option to upload it in the drive. Okay, where once you upload it in the drive, then we will get the automatic notification. Okay, then whenever I have the time, then I will visit and I will have a look through your assignment topics. Okay, so these are the few things that we do at Elite Expertise. And then I would like to explain you about this KAPS examination syllabus. Briefly, I want to go with this syllabus, like how the examination syllabus it will be, and what are the topics that you need to study for the KAPS examination, and how the exam pattern it will be. Okay. So like KAPS examination, it will consist of the two papers, like paper 1 and paper 2, and how many questions in each paper. So this everything that I will discuss you in detail. Okay. And like before that, I go in detail about explaining this KAPS examination syllabus and the pattern of the exam and what is the passing score for the examination. Okay. So I will pass it over to, or I will hand over to Rekha, okay, so that Rekha can continue this session, because at 7 o'clock you will be having a presentation with Sherri Barden. So she will give a presentation on asthma as well as the hay fever, and after Sherri Barden's presentation, then I will continue and I will explain you about the KAPS examination syllabus and so on. And also at Elite Expertise, so we are always we are trying our best to collaborate with others as well. Like we are trying our best to collaborate with the experienced pharmacists here in Australia, like Sherri Barden, as well as we also have the other pharmacists, so that after completing your examinations, and once you become an intern pharmacist, okay, so you'll be having a good chance to interact with them. Okay, so like they can share their experience as well as they can they will guide you in a better way that how to become a pharmacist, and what are the other steps after becoming the pharmacist, how you can improve your career as a pharmacist. So everything will be guided by them. Okay, so already we started collaborating with many pharmacists from different zones in Australia. Okay, so today you will be having a presentation from our chief guest, so with Sherri Barden. So, and now I will pass it over to Rekha. So Rekha can continue this session. Thank you, Rekha.
Thank you, sir. Hello again. So as sir said, you all will be having a session with Sherri Barden. She'll be taking a half-an-hour session, and then Arief sir will continue explaining you regarding KAPS exam syllabus, exam pattern, etc., followed by question and answer session. So before Sherri starts her session, I would like to introduce my favorite. I hope you all of your favorite, our director, co-founder, as well as educator, Mrs. Harika Bheemavarapu. As I said, she is the director as well as educator at Elite Expertise. Harika ma'am did her Bachelor of Pharmacy as well as Master of Pharmacy in India, and started her career as a pharmacist in Australia back in 2018. She have been practicing in Australia for almost 6 years and has mastered in various clinical skills. She is a proud mother of 2-year-old, and but she never lost her passion for pharmacy practice as well as teaching. So her hardworking nature, empathy towards students as well as patience, and her kindness towards everyone always inspires me. It never failed to inspire me. So yeah, as I said, one of my favorite, and I hope she becomes favorite to every one of you. Along with this, she's also an accredited consultant pharmacist and a member of Society of Hospital Pharmacists in Australia. Currently, Harika ma'am is working as a clinical pharmacist and clinical pharmacist educator at Monash Teaching Hospital. It is one of the top hospital and research center in Australia. She has an impeccable track record in training students for KAPS exam over years. So I would like to hand over this to Harika ma'am. I welcome you, ma'am.
Oh, hi. Hello. That was a good introduction about me. Thank you.
Good evening,
It was not scripted, I believe. It's from
Good
your
evening,
heart.
madam.
Good
Hi.
evening.
Good evening, everyone.
Hi, ma'am. Good evening.
Good evening.
Good evening, ma'am.
Good evening. Good evening. Good evening. Good evening. It's nice to see you all.
Good
It's nice-
evening.
Hi. Good evening. It's nice.
Good evening, ma'am.
Good evening. Good evening, guys. Okay. So it's very, very nice to see you all here. So our second batch students have just finished their exams, and today is our orientation session. And like Rekha has given a good introduction about me, thank you. So I moved to Australia in the year of 2008. So I was a pharmacist in India. So I moved in 2018, and then I worked as a pharmacy assistant for like 4 months, 3 months in one of the warehouse shops in Australia. And then I decided, no, I'm not working as an assistant. I should be a pharmacist. So I cracked KAPS. So it took me like 2.5 months to crack KAPS. Like I was working part-time, and I used to study on weekends. And then after that, I finished my internship in a very good pharmacy called Moama Village Pharmacy. One of my teachers over there is joining us today. She's an asthma educator. And then I wanted to do, I want to make some worth out of my profession. I wanted to practice clinically. So I searched for opportunities after my internship. My internship itself was a great opportunity for me, where I learned asthma education, diabetes education, sleep trials, pain trials, and we had a pain management clinic. So I participated in that. And then we had like naloxone pilot project, where we are helping patients, preventing that opioid overdose and deaths. So I was a part of that project. So I got that, I was so privileged. I got the chance to get into those community projects. So my internship itself was a boon for me, because not everyone gets that chance. So Moama Village Pharmacy, where I finished my internship, was one of the best pharmacies in Australia. It has also got an award to be Guild Best Pharmacy of the Year when I was working there. So, and then after that, I was searching for hospital opportunities, because I wanted to practice and make some meaningful impact on people's lives. So the community practice gave me like a first-hand exposure. So where you get a chance to treat minor ailments, and you get a chance to explain what happens, give that health education to people, and then strong referrals. If something is going wrong, you refer to the GP, general practitioner, where you can stop something straight away. Like prevention is better than cure. And the treatment, if it is initiated in an early stage, as we all know that early intervention matters. For any disease, if we act early, then it matters. So as a community pharmacist, I feel so proud when I worked there, like in a community pharmacy, when I was doing internship, that I could stop that, initially, like someone is like neglecting their health, where I could push them to see a GP, think again. And I could be that first-hand help, where anyone can walk in and ask me for some help or some advice, and I could give them. So obviously, I'm not practicing just because I've studied pharmacy, but I'm practicing so I can help people. So, and then I moved to hospital. I really, I was so lucky. I got a chance to work in a regional health, Victoria. It was a very good district hospital. There I worked, and like after 2019 till this year. And this year I moved to Monash Health Hospital. Monash is a very good teaching hospital, research hospital in Melbourne. So I'm a part of the Monash Health organization. I work as a clinical pharmacist and clinical pharmacist educator at Monash Health Hospital in Melbourne. So that's about me. So, and what is the takeaway point of my introduction is Arief sir has covered how we teach and teaching methodology. So what we do is we teach you what we practice. So suppose you have a case study where we teach you a case study. It's not something which we made up. It's not a book case study, but it's a real life example. You've got a patient like a couple of days ago, not even a couple of days ago, yesterday when I was practicing, I saw a patient, wound infection, some anaerobic bacteria has caused it. They've started clindamycin. And within like 2 days, she started developing diarrhea. And then they have requested me to, dispense some, vancomycin oral. So it's like real life case studies, which we learn from our practice and which we give them to you, because it's not just being about making you become a pharmacist for any other reason, but you being a pharmacist for helping people. Okay. So, and like knowledge is beautiful, as I always feel. And if you strive to acquire knowledge rather than just clearing the exam, oh, I have to clear the exam. What's next? No, don't worry about the exam. Just learn how you can help someone, and that you will clear the exam automatically. Okay? So that's about exam, my strategy, and like how, even in for life, if you're trying to do with a good intention, success is yours. So if you want to be successful, just start anything with a good intention. And if you believe or not, God will help you. Okay, so I will introduce you, Sherri Barden. I hope she's.
Hi, Harika.
Hi, Sherri. How are you?
Well, thanks. How are you?
Good, thank you. Nice to see you. Let me introduce you to all of them, and then we'll go from there. Thank you so much once again. So I think you've got 150 audience.
Wow.
So let's see how it goes. It's exciting though. One second. Okay, when Sherri is speaking, please mute your microphones. Anyone who doesn't mute microphones, or who makes some noise, will be removed from the call. I'm so sorry, but let's respect this talk because it's very important for us. Okay. So I'll introduce you all to Mrs. Sherri Barden. I hope all of you can see this.
Yes.
Yeah.
Yes.
So Sherri
Yes.
Barden, yeah, my lovely teacher. I'm so happy. So Sherri Barden, Mrs. Sherri Barden studied at Monash University, Melbourne, and completed her internship at the Royal Children's Hospital in Melbourne in the year of 1997. She's got overwhelming experience, I should say. So since then, Sherri has been a community pharmacist working in rural and regional pharmacies across Victoria, Queensland, and New South Wales. Sherri now lives in her hometown of Moama on the Murray River with her husband and 3 teenage boys, and works at Moama Village Pharmacy. That's where I finished my internship, as I said. Proud to be a part of the team. A top 5 finalist in the Pharmacy Guild's Pharmacy of the Year Awards in 2020. Sherri Barden has a special interest in respiratory medicine and asthma. So she completed the asthma education course at the Alfred Hospital, Melbourne Lung Health Promotion Centre in the year of 2017, and has then offered asthma education to her local community within her pharmacy. So she has also been involved with 2 trials with the Woolcock Institute of Medical Research over this time. So in the year of 2021, amazingly, Sherri became a member of both the Respiratory Task Force Leadership Team and the Pharmaceutical Society of Australia CSI Respiratory Care Leadership Group. In the year of 2022, Sherri launched Moama Village Pharmacy's hay fever clinics as lead pharmacist and clinic champion. With the success of both clinics, Moama Village Pharmacy has now started charging a fee for service for these clinics. So Sherri, with the support of Moama Village Pharmacy, has now started up Sherri Barden Consulting Services, where Sherri is coaching other pharmacists to successfully implement their own hay fever and asthma clinics. So it's like a community service, which Sherri is pushing forward and trying, implementing and coaching them to help them establish their own clinics across Australia. So the coaching Sherri offers for pharmacists in Australia, like pharmacies in Australia, to establish the clinic is via both face-to-face and by virtual sessions. That's about my teacher, Sherri Barden. So today, she's being a respiratory, specialist pharmacist. So she'll give a talk about respiratory medicine, asthma education, and how things work in Australia. So for all of those who are aspiring pharmacists, starting to give their KAPS exam or starting their internship, it's a very good knowledge talk, and try not to interrupt. 1 second, let's stop presenting that. And over to Sherri.
Thanks very much, Harika. Thanks for your kind introduction, and welcome everyone. I'm going to share my slides with you. I'm going to speak for about 15 to 20 minutes on both asthma and hay fever. So we're going to start with hay fever. I'm going to show you quite a few slides. I don't want you to worry too much what's in those slides, but more so where you can find those slides later on. I'm just bringing up my slides, if that's okay.
That's a beautiful picture of yours.
Oh, thank you, Harika. Okay, let's start. So everyone, as per introduction, if there's some information about myself, I am really proud to be a professional services pharmacist, community pharmacist. And I've also started up my own business, my own brand. It's very new, very exciting to launch this with you all. It's called A+ Pharmacy, and this is my new brand. So you can find me, you'll be able to find me on LinkedIn, and I'll show you that at the end. There'll be a QR code for any further information that you may need. So we're just going to go to the next slide now. And how do I get down to that? Because it's not allowing me to. Maybe I'll just go. Here we go. Okay. So hay fever. Hay fever, we're going to start with some facts. So the medical term is allergic rhinitis, and I'm sure in all of your countries you have patients that suffer from this condition. And in Australia, as you can see, as per fact 1 in 5 Australians suffer from allergic rhinitis. They can suffer all year round or just seasonally, which is springtime in Australia. Right now, it's happening right now where patients are suffering. They are allergic to pollens. Now, if they suffer all year round, they're allergic to either house dust mite, animal dander, mold, or pollens. And that can be grass, tree, or weed pollens. And we see it both in the country and in the city. And if we go down to fact 2, we can see that the symptoms can be so bothersome for hay fever. They can include itchy nose, itchy throat, itchy eyes, sneezing, clear runny nose, really congested nose. And this can really have a significant impact on a patient's sleep, their concentration, their learning and daily function, and overall quality of life. It affects childhood behaviours and development as well. Now, hay fever is often undiagnosed, untreated, and suboptimally self-treated. And we can see this in fact 3, in that there was an Australian study in pharmacy that showed that 70 to 80% of patients self-selected their hay fever treatments off the shelf, but only 15% of patients selected the appropriate treatment for them. And that's quite alarming because I see that a lot. They go and what they're selecting is the oral antihistamine tablets, when in fact they might have more severe hay fever and be requiring a step up in their treatment. Next slide. So first of all, once we think we've got the correct diagnosis, we can classify allergic rhinitis into being persistent, so happening more than 4 days a week and more than 4 weeks at a time. It can be intermittent, which means it just happens occasionally. Symptoms is less than 4 days a week or less than 4 weeks at a time. Now, when hay fever is mild, it's not bothersome. So these patients, they get it occasionally. They can sleep normally. They can go about their normal day activities. They can concentrate. It doesn't really affect them. It's not bothersome. But for those that have more moderate, severe symptoms, that's when it starts affecting their quality of life, and they can get these symptoms that you can see there, such as abnormal sleep, impairment on daily activities, poor concentration, and so forth. When we look at the next slide, it's for those patients that are mild, that we spoke about before, that have very mild, not bothersome, so it doesn't affect their daily life. We can see sort of in this slide from the ASCIA website, and I'd like you just to maybe write that down or note that just in the left-hand bottom corner there, I'll just show with just here, ASCIA is the Australasian Society of Clinical Immunology and Allergy. And this is a fabulous website that has all the information you need for allergic rhinitis, asthma, anaphylaxis, with some wonderful resources here. So as you can see from this treatment algorithm, that we can see for patients that have mild hay fever that is not bothersome and not affecting, they have normal function. These patients are the ones that are indicated first-line treatment just for oral or less sedating or intranasal antihistamines, plus or minus nasal saline irrigation, and of course allergen avoidance where possible. Now, this is only a small minority of patients. The larger minority of patients have persistent, mild or mild to moderate to severe symptoms, and this is affecting their quality of life. So it's very bothersome to them, and that's the word I use with hay fever a lot. How bothersome are your symptoms? And I use a visual analog scale, which is, I ask them on a score of 0 to 10, how bothersome are your symptoms when they're at their worst? 0 being not bothersome, 10 being bothersome. And in my clinics where I've started seeing patients, the ones that are coming into the clinics, their hay fever is an 8 out of 10 to a 12 out of 10. And when I say 12 out of 10, it's off the scale. It's how severe it is. And they've been quite, they've been suboptimally self-treated and undertreated for so long. And when they present to me, they've sort of say they've tried nasal sprays, they haven't worked. And they tend to be just on the tablets at that time. And I know that I can definitely step up treatment with some education, with a little bit more time spent with them. So we can see that anyone that has some bothersome effects as symptoms, that their first line treatments are really the intranasal corticosteroid sprays or the combination treatments. So you can have a look at this one later, but we'll move on. Now, this is from the Australian Medicines Handbook, and I really love this chart because it looks at the different classes of medications to treat hay fever and how effective they are for each individual symptom. And if we look at the oral antihistamines, which are the top, the second generation antihistamines, we can see that they don't have much of an effect on most of the symptoms. But when we go down to the intranasal corticosteroid, it has a much better effect, as does the combination therapy of the intranasal antihistamine and intranasal corticosteroid down the bottom. And we've also got the other available therapies in there as well. Now, I love this chart when I'm educating because it's really important to show patients, and I have this on the wall in my consult room, or it's something that you can have on your wall next to your hay fever treatments and in your pharmacy. And it's from the National Asthma Council, so you can Google them for these resources chart, and they can actually send you a free wall chart, or you can download it and print it off. And I understand that some of you pharmacists are going to be working in hospital pharmacy and some of you in retail pharmacy. And for those in hospital, you may not see or be treating hay fever as such, but it might be on the medication chart. And it's really important to make sure that their hay fever is well controlled, which may help control other conditions such as asthma. Now, most patients that come to see me in the clinics, like I said, they're on only an oral antihistamine tablet, which is not strong enough for their hay fever, and I need to step up their therapy, but they're very confused about which nasal sprays to use and when, and that a lot of them don't like nasal sprays. So you'll find in your conversations, you'll say a nasal spray, may I suggest a nasal spray, it could be a lot strong, it may be a lot stronger for you. And people say, oh no, I don't like nasal sprays. But if a lot of the times they've never been taught how to use a nasal spray correctly. And as we know with asthma, and that inhaler technique is so important, it's the same with hay fever treatment. If we give someone a nasal spray, it's very important at every opportunity to explain how to use a nasal spray correctly. Now, we can also always Google these or ask the patient to look it up, or you could watch a little screen with the patient to actually show correct technique. Or if you're not aware of how to use correct technique, it's gently, everything's gentle. Blow your nose gently first, prime the nasal spray first, shake the bottle, blow your nose gently, and then we're going to use the opposite hand to spray just gently into the outside, like at a 45-degree angle to the lining of the outer nose here towards the back of the ear, away from the midline. And we don't want to be snorting it straight up because we may lose a lot of the dose and increase the risk of side effects such as taste or nosebleeds. So it has to be very gentle. And when we're just spraying it here on the angle, we just want to try and inform the patient to keep it in their nose and it's all very gentle with a slight head tilt forward, and then we're repeating with the other in the other nostril. Really important when I'm explaining these treatments, I go through each class. So I usually start with a saline, and that's a non-medicated flush to rinse out all the allergens, and if we have a virus, it'll be the pathogens. And you can do that as often as necessary, and you can also do that 10 minutes before your medicated treatment. You can have it in the rinse or the spray form. Then I talk about the antihistamine class. Now it's missing Zyrtec here as well. And that's essentially your oral antihistamine tablet in a nasal spray that may have a quicker onset of action than a tablet. Then I go over to the preventers and say, these are their medications that can actually use to prevent your hay fever. But they do take time to work. And again, it's really important for correct technique, and they do require a loading dose at the start of treatment. So all this counselling advice is really, really important, so that we don't have treatment failure, and you have very happy customers that come back to you because their quality of life, their hay fever has gone from a 10 out of 10 down to a 0 out of 10, which we would expect from using a preventer every day. It just has to take time, and it takes motivation and commitment, and that advice, that critical advice for you to say, I want you to use it every day. I want you to use a loading dose. I want you to use correct technique, and then to perhaps come back and see me to let me know how you're going. And with my clinics, I do offer a 1 week and a 4 week follow-up call just to see how they're going and to gather all that evidence and all that information. And that gives me confidence that I can then flow on to my staff, and some real good case studies to tell my staff about as well. And also now that I'm going to visit other pharmacies, I'm able to share those stories with other pharmacies. So this is critical, is the preventers where possible, and particularly any patients with asthma. We want to see them, first line treatment is actually to be using an intranasal corticosteroid, and that's okay to be using with their inhaled corticosteroid for asthma as well, because we really need that good control. Then I talk about the fact that we can have the preventer in combination with an antihistamine spray in a combination therapy. And as most of you may be aware, Domista has just been down-scheduled to a pharmacy-only medicine and is available on your shelves right now. Now, it's a little bit more expensive, so price points are always a consideration for people. So we're giving them the options of, well, this is a 2-in-1 device. It is a little bit more expensive. The dose is 1 twice a day. So we always like to consider, is this patient going to actually use this twice a day, or would they be of more benefit perhaps using their Nasonex once a day, every day, and perhaps using up their Telfast tablets at home while they're introducing Nasonex, because as we know, it's important to, if you're introducing a corticosteroid alone nasal spray, you can use your tablets or your intranasal antihistamine for the first week or two while these are gaining full benefit. Or we can have it all in a combination treatment, and we can see a couple of these are still on prescription. So the Rayaltris is still prescription, the Omnaris and the Avamis are still prescription only. So that is a beautiful overview. I'd love you to all get a copy of that and just use that for reference. And that is the end of my allergic rhinitis talk. I'll just make sure I've checked everything that I've said. So technique, really important. Having some good information, giving them some really important information. And it's really important to know that effective treatment of allergic rhinitis is really important in the management of asthma. And we'll move on to asthma at this stage. Asthma is really important, and I'm very passionate about because it is in my family and I do suffer myself as well. In Australia, 1 in 9 Australians suffer from asthma, and more than 1 Australian dies per day from asthma in Australia. It can't be cured, but it can be very well controlled with the medication that we have available. Fact 2, asthma is reversible and variable, and so we can have normal lung function one day, but the next day, if we're exposed to a trigger, our asthma, we can have an exacerbation that can come on within minutes, within hours, or over days. So it can be very variable. And so when our patients are presenting to us on any given day, They might have had good control last week, but they may not this week. So it's really important to check in with them all the time. Symptoms can include one or all of the following: a wheeze, a shortness of breath, tightness in the chest, or cough. Not all asthma patients have a wheeze. Not all asthma patients cough, but they may have one or all of these symptoms. And the alarming statistics in Fact 3 show that up to 90% of patients use their inhalers incorrectly, and up to 50% of patients do not use their preventers regularly. And it's with these statistics as to why I really am passionate about this area, because I know that if we can get this right, and this is a pharmacist's role in medication management to ensure that patients are using their medications correctly to get the best treatment outcomes. What's happening in asthma in this visual here, and what I can also, I know you can see me, but I can't see you all. I also am very visual in my education. So I will show patients what is happening in asthma and how the medication works. So as you can see in this picture, and you can see in what I'm holding right now, is essentially what's going on in the airways in asthma. So this is the normal lung here, where we can see normal airflow, normal lining, normal mucus, muscles are relaxed. What happens in asthma is when we're exposed to a trigger, and we know that the number one triggers can be cigarette smoke, pollen, infection, dust. So they're sort of the main ones. Fragrances, there's lots of triggers, even medications, some medications, as we know. But what is happening is the trigger gets into the airways, and the airways are tightening, and there's that smooth muscle tightness and spasm saying, I don't want to get that, I don't want that trigger in here, I want to get it out. So it's tightening, and you're coughing and you're wheezing. And then the next phase is the inflammation and the mucus production, blocking off the airway even further. And so when I'm educating about medication, I'm educating that Ventolin only works on the tight band on the outside of the airway. It doesn't work on the irritated, inflamed inside of the airway, and that's where the preventers work, which you are all aware of. Now, I love this chart as well, and as before you saw with the allergic rhinitis medications, this is the most up-to-date chart with all of the asthma medications, inhaled medications, as well as one oral there, which is Montelukast. It doesn't have the monoclonal antibodies for severe asthma, the injectables, but it does have everything else. It was up to date as of the 1st of August, and I would encourage you to have this on your desk, very handy all the time, or with you at your workplace. In our pharmacy and in the pharmacies that I'm educating to, I take along this wall chart. It's a great size, and put it inside in the consultation room, and also on the script in desk. We laminate it and we put it on the desk so that when patients are requesting salbutamol, for example, over the counter, we can have a really good conversation with them. It breaks down the barrier to, and it also opens up conversation in that you explain to the patient, there's so many medications available to treat asthma and treat your asthma so much better now. And it's a visual, and then they're like, wow. And then you might say to them, are you on a preventer, when they request salbutamol? And they say, yes. And have you used salbutamol before? Yes. It's almost not enough knowing the statistics that 50% of patients are non-adherent to their preventers, and 90% of patients use their inhalers incorrectly. So when a patient says to you, yes, I'm on a preventer, I'd like you to ask that next question. Which preventer are you on? And they could point to this chart, and maybe if it's Symbicort, is it the Rapihaler or the Turbihaler, or is it in the Seretide, is it the inhaler or the Accuhaler? And then the next question, really important, is to how often do you use your preventer? Because if we don't ask them that, we don't know whether they're using it as prescribed. So a lot of the patients you'll find will say, I'm using Symbicort once a day, I'm using Seretide once a day. I had a lady the other day say, Seretide, I'm using it 3 puffs in the morning. Or I had another lady saying, my Seretide, I just use it when I get symptoms. And so you really get that more of a conversation and understanding about their asthma. And it's at this moment too, it's really important to say, how's your asthma control at the moment? And they might say, it's fine, I'm using Ventolin 5 times a day, but it's really important for you to to explain to them that that's actually not well controlled, and what we need to do is for you to have a review or to have some further education. And I can show you that you know, we can show you in that moment that there's so many amazing treatments available for asthma. And we can show the stepwise approach. We can show that we have the preventers alone that work on the inside of the airway. We have the combination with the long-acting Ventolin as well as the inhaled corticosteroid, which is combination therapy. And then we even have the triple therapy. So if I have someone on Seretide twice a day, every day, their meter dose inhaler via a spacer, so I know that they're using it properly via a spacer and they're using it every day as prescribed twice a day, yet they still can't get control. We can show that that there's now triple therapy available for asthma. And a lot of the patients say, wow, that I never knew that. How come my doctor has never told me that? And a lot of them, I find, take a photo, so they might take a little screenshot of that corner and say, I'm going to ask my doctor about that. And again, that opens up a real beautiful conversation between the patient and the prescriber, and the patient becomes more informed. And again, and from that, you get that job satisfaction that you've actually helped someone and you've had a really great conversation with someone. And this can have a very profound effect on their quality of life and treatment outcomes. Now, we know there's so many devices available for asthma with all of the inhalers and COPD, and the different classes we have available. So as we can see here, the devices, we have the pressurized metered dose inhalers, the dry powder inhalers, the soft mist inhalers, nebulizers and spacers. Which inhaler is right for your patient? It's important to involve them in that decision making. If they haven't done that with their GP, it's okay for you to ask that patient, do they like their device? And as per previous screen, you can show them all the different types of devices that are available. It results in obviously a confusing number of choices for not only the healthcare provider as well as what I just said, the confusion for the patients. But it's really important for them to get this right, to help manage their disease. Now, I don't let a person leave my pharmacy without a spacer if they're using an MDI, and you can see the reason why. And you might find in the past, you might be a little bit shy to suggest a spacer, or maybe your staff don't suggest spacers, but this is a really important part of my education when I'm going to pharmacies and speaking to not only their pharmacists, but also their staff, that it's really important to show a visual and able spacers. Actually, you can see, I haven't got it on the slide, but you can see here in front of me, they have this little flyer that you can show patients at each opportunity that do they use a spacer? Would they like to buy a spacer? It can actually improve the deposition of the medication into the small airways and have so much more of a better effect if we use a spacer rather than just the MDI alone. And so I think if you visually show them, then they're more likely to purchase. And then it's really important to educate how to use a spacer correctly. And a lot of people think spacers are just for children, but they're for everyone. And a lot of people think spacers are still the big, old-fashioned volumatic spacers, where in fact now spacers are so small, as you can see here, that you can actually even keep your Ventolins inside. There's two ways of teaching how to use a spacer, and you can coach. I prefer the technique where you shake upright, you spray, and 4 normal breaths in through the mouth, out through the nose, just with normal breathing. Rather than shaking and 1 big breath and holding, because that patient can often be short of breath or very sore through here. So if we just do normal breathing, 4 normal breaths, it's a much nicer way. And we call that tidal breathing, of educating. Shaking between each spray, and also 1 spray at a time. All those little tips are really important. And sometimes I do dose patients in my consult room. If you can visually see that they're having trouble breathing and they're happy to buy a spacer, I sit them down and they dose with me. And I say, now think about how you're feeling right now. And we're actually going to dose some Ventolin with you through a spacer. And then I'm going to ask you in a couple of minutes after that how you're feeling. And it's incredible to see the difference. And when I thought of that, I just thought back to my hay fever slides, and I forgot to mention about eye drops for hay fever. Well, we spoke about nasal sprays and tablets, but eye drops are really important, and we've got a great range, and Xanatan and single-use Xanatan, preservative-free, is probably really effective, one of the most effective, along with the antihistamine eye drops. But it's really important to be talking about that as well with your patients, because I've had some dose with me in my clinics and with a Xanatan and get that immediate relief. And that's what made me think of it, because when they're dosing the Ventolin with me, they're getting that relief as well, which is really great. So as you can see, really, really important to be suggesting a spacer at every opportunity. Another little tip with asthma, it's really important for the patients know asthma first aid, and it's really important that, and they might say, oh, well, I've never had an attack, but it might be important to say it might not be you requiring asthma first aid. You might be actually helping someone, because 1 in 9 Australians suffer from asthma, and all first aid courses within Australia do cover asthma first aid. You can print this out from the National Asthma Council, and you can actually be giving it to your patients or asthma patients as well. It's a nice little leaflet to give out to patients, and it's particularly in this thunderstorm asthma season, but absolutely all year round. I haven't touched on thunderstorm asthma, but it's certainly a consideration at this time of year and springtime, and it's actually until the end. For those people that are listening from Southeast Australia, our thunderstorm asthma season is from the 1st of September until the end of December. And some of the patients that do have thunderstorm asthma not only have an asthma diagnosis, people that can be at risk of thunderstorm asthma are patients even with a history of severe allergic rhinitis but have never had any asthma before. So they may be at risk of thunderstorm asthma. So it's important for them not to alarm them, but inform them that you can buy Ventolin over the counter, that if you do have any trouble breathing, to act straight away, or someone around you might have a Ventolin, and that's what we use for asthma first aid, and ideally through a spacer. And the first aid is as simple as 4 puffs every 4 minutes, ideally through a spacer, until help can arrive. And we know that if for those patients that maybe have Symbicort at home and they can't find their Ventolin, that Symbicort has the quick acting LABA in it, so we could use that for first aid as well. And there's even the information with the latest first aid charts that if you can't find if you don't have a spacer, you could use a rolled up piece of paper, or the end of an empty plastic drink bottle or a polystyrene drink bottle. So there's lots of little tips there as well. I'd like to refer you to also for information about asthma to the Asthma Australia Handbook. It's the national guidelines for health professionals and provides best practice, evidence-based guidance translated into practical advice for primary care professionals. So I'd really recommend you all to have a look at that as well. I'd like to also just touch on how to use an MDI, to talk about, to just sort of go back to using your devices correctly. Now, obviously, I've touched on a spacer, and that's really important for MDIs. If we're using a metered-dose inhaler without a spacer, when we're using it without a spacer, it's a slow and steady inhalation, and that's to be over 4 to 5 seconds, and that's really, really hard to achieve. And that's another reason to recommend a spacer, because it takes away the coordination, the effort, and really helps with that deposition. So with the metered dose inhalers, we're shaking upright, we're emptying our airways, we're doing a slow and steady inhalation. over 4 to 5 seconds, and then we remove the device and hold that breath for as long as comfortable, which is really difficult to do when you're short of breath, as you know. The dry powder devices such as the turbihalers and the elliptors, it's a quick and deep. So when I said slow and steady for the metered dose inhalers, for the dry powders, it's a quick and deep. And often patients don't have that inspiratory effort when they're breathless to actually really breathe in that dry powder, but because it has to be quick and deep. So that's why it's really important to assess at every opportunity, is it the right device for that patient? And if not, refer them to their GP as soon as possible. This is my final slide, and then Harika is going to ask any questions that you may have had for me. This is a QR code that you can, that is linked to my LinkedIn profile, which is a brand new page. You'll see I only have 2 followers, which is myself and a lady who set it up. It's launched today, and I'm going to start putting some information on there about some of the pharmacies I've been to, some of the podcasts I've been interviewed on, and sharing with you all the information and what I'm doing. So yeah, please feel free to join that, and you'll see some information coming. You can message me via there. I can offer you a virtual education session package, which is a 3-hour session with your pharmacy, with your colleagues, with your own business owners, or it might even be just purely for yourself. So we can talk through that that way. And I think I will stop sharing from there. Harika?
Yes, thank you.
And I got through it as quick as I could.
Yes, that is so informative. Thank you. And Sherri is open to questions, but please type the questions so I can filter them out and I can ask any suitable questions regarding asthma or, the talk, allergic rhinitis and heavy otolitis and all that. So if you can message me any questions, guys. So that was brilliant, actually. You can use a paper, is it? Like a roll paper.
Yeah.
Like emergency.
Yeah.
I really didn't think about it. So what does it do? Does it direct the dose properly, like what a spacer does?
I think it slows down the. It also slows down the speed.
Yeah.
And the patient in that moment obviously is having an exacerbation, can't breathe. So we just want to keep them calm. We want to keep them upright. We just want to try and do normal breaths. And if that can just slow down the velocity and the speed and just really help them try and get some in, really important.
Yeah, yes. So I've got Aisha asking a question. Does allergic rhinitis cause asthma in the future? Does it cause asthma in the future?
That's a very good question, because yes, it can. It is a risk factor for future development of asthma. So it can. And that's also leads me to a very important statistic that I did not say to you all. And 80% of patients with asthma have allergic rhinitis. And if we can't control that upper airway, then it can lead, it can be very difficult to control our lower airway. So at every opportunity that someone's presenting with you for asthma at the moment, we need to be asking them, do they have hay fever, and how's their hay fever control at the moment? So we want to control the upper airway and the lower airway to get best treatment management.
Thank you. Any other questions? Oh, okay. Any other questions? So one of our students is saying, in India, spacer is banned because of the toxic plastic material used.
Wow, that's interesting.
Yeah. Can sinusitis be also compared to allergic rhinitis?
Can it be compared to?
Yeah. Can it be compared, maybe symptomatically or something? I don't know.
similar symptoms.
Yeah.
Sometimes sinusitis can be infective, which we would treat differently. But yes, it can be managed with the nasal sprays.
Yes, true. Yeah.
For sure. If we're just unsure of that correct diagnosis, we're referring to the patients. The patients that are coming to my clinics with allergic rhinitis, they do have those symptoms of allergy. So they've got the sneezing and the itch and the irritation, as well as the rhinorrhea and the congestion. So sinusitis, if you're just getting the congestion, so it might not be allergy related, so they might need that referral.
Yeah, for infection. Yeah. So when counseling, this is an interesting question. When counseling the patient about asthma and rhinitis, do you talk about diet and nutrition? So actually, if you remember, we have done a pain trial together, and we always talk about diet and nutrition.
It's a great question, but no. So in that time frame we have, I'm sticking to time, so more therapeutic, and there's probably not strong evidence to show any benefit or avoidance of particular food or diet. But absolutely, we want that healthy individual. Absolutely, like the overall, that holistic view of that patient in the moment. So and some of these patients may qualify for a meds check as well. So if they're on other prescription medicines, we could be seeing these patients in meds checks, or even with that asthma exacerbation, that's actually ticks the box for a meds check as well.
So there's one more question. Is there any prophylactic medication for rhinitis?
For allergic rhinitis, yes. So that's the intranasal corticosteroids.
Every day,
Absolutely, every day, and they are very safe. They're they just work very in the nose. There's negligible systemic absorption. I think for hay fever season, yes, they can use it every day, and would even like them to start at 2 to 4 weeks before hay fever season, because we know it takes time for them to take effect. If they're using it all year round, we would like the GP involved in that. Absolutely, just to make sure that doctors are aware that they're using it, and for the doctors to have a really good look at, up their nose and the back of their throat as well, and maybe even ENT referral if need, or allergy testing and everything else they may need.
Yeah, I think I'll take one more question. So how long can the nasal spray be used in case of allergic rhinitis? I think they can use it lifelong, right?
The intranasal corticosteroids, and like I said, if they're using it more than just that seasonally, we'd like to have the GP definitely involved in that longer term. So, and when you're talking through that slide I showed you of all the nasal sprays for allergic rhinitis, it's a very good question, because it's how long can we use all those? And I didn't touch on the intranasal decongestants, because a lot of people will go for the decongestant nasal sprays that can be only used for 3 to 5 days. So it's really important. So we've got the saline that can be used ongoing long term. We've got the saline class. We've got the intranasal antihistamine sprays such as AZEP. It can only be used for 6 months continuously. But the intranasal corticosteroids can be used ongoing. But yeah, that's really important to know when you're recommending. But be confident that you can, particularly those patients that are suffering seasonally and that are suffering quite severely, that it is safe to do. So they need that real clear messaging. Definitely.
Yeah. Yeah, I think all the other questions are I can answer them later. Yeah, this one question. Is an autoinhaler better than a spacer for patients? No.
No, not better. No.
No. Yeah. Thank you so much for an amazing talk. Thank you so much, Ray.
Thank you for having me, Harika, and I wish all of you listeners all the best in your internship and with your exams and working in Australia. I hope you really, really enjoy your time, and wishing you the best.
Thank you so much. See you.
Bye.
Bye. Okay, so that was a lovely talk from Sherri. So all the other doubts you have about asthma and all that, we can answer during the classes, so don't worry about it. So she's a specialist in respiratory medicine, so I've popped all the relevant questions which are unique in their own. Thank you so much, guys. So over to Rekha. Are you there?
Yes, ma'am. Thank you.
Okay. Okay, guys, thank you so much. See you soon.
Thank you, ma'am. Okay, I hope you all had informative session with Sherri Barden. So, as discussed, sir will continue the session. Sir will be discussing about exam pattern, exam syllabus, and few other details. So let's just wait for sir. So, ma'am have to go back, take care of her hand so that sir can come and start the session. So let's just wait a minute. Sir will be back. And after the sir's session, there'll be question and answer session. You can ask all your doubts regarding exam, syllabus, or any questions related to KAPS exam. You can ask sir. Sir will be back very soon. Let's just wait a minute.
Thank you so much, Rekha. And I'm going to present the remaining part of the presentation, guys. So I'm going to discuss about the KAPS examination syllabus and how the KAPS exam papers will be and how much percentage that you need to pass for your final KAPS examination. Okay, I guess you had a presentation by Sherri Barden, and as already I mentioned that we are collaborating with a lot of other pharmacists, Australian pharmacists here in Australia. Even when after finishing your KAPS examination, by the time when you are doing your internship, so they will be with us. They will be a part of our team, and they will keep on guiding you, okay, for your better career and how you can improve yourself as a pharmacist in Australia. Okay, so I'm going to present my slide now. I hope you all can see this slide. Thank you. And after finishing this KAPS examination syllabus and the exam pattern, okay, so once it is done and once we discuss about the what is the passing percentage and so on, then later on there will be a Q&A session. Okay, so you guys, whatever the question that you have that is related to the KAPS examination, then you can just keep asking me. Okay, so the next part is about the KAPS examination syllabus. So this is the most important one because when we go and visit at the APC website, so you can find a lot of the content of over there. And most of the candidates, once they see the syllabus in the APC website, okay, by seeing the syllabus itself, they will get demotivated and they will try to drop off by giving this KAPS examination. Okay, so this KAPS examination, it consists of the two papers, that is the paper 1 and paper 2. So in the paper 1, you will be having chemistry, physiology, and pharmacology. So these three are the main components that are included in paper 1. And for chemistry, it covers around 30% of the weightage. And for paper 1, in paper 1, there will be total 100 MCQs. So you need to answer 100 MCQs in 120 minutes. Okay? So that is for 2 hours exam. And there will be 100 MCQs, and you need to answer 100 MCQs in 120 minutes. And out of 100 MCQs, 30% weightage, that is roughly around 30 MCQs, will be from chemistry component. Okay? And the remaining 70% will be from physiology and pharmacology component. Okay? So 30% from chemistry and 70% from physiology and pharmacology component. Okay? So in this way, the paper 1, it will have 2 main components. One is the chemistry part, and the other one is the physiology and pharmacology part. Okay? And in chemistry part, okay, these are the things that which they cover in chemistry. So the first one is about the organic chemistry. In organic chemistry, they will ask you about the basic structures like amine, amides, indole, quinolones, pyrrole, pyrrolines, and so on. So such basic structures of that compounds will be given, and you need to identify what structure it is. Okay, so that is the first part, that is the organic chemistry. And you will be having the medicinal chemistry, where you need to study about the structures of the antibiotics and structures of like adrenaline, noradrenaline, digoxin, and so on, and also few important structure activity relationships. Okay, like especially structure activity relationships are important for antibiotics like penicillins and cephalosporins, like how ampicillin is different from amoxicillin. Okay, how benzyl penicillin is different from phenoxymethyl penicillin. So these are the basic things, the structural differences they will keep on asking you in the examination. Okay, so that's the major thing that gets covered in medicinal chemistry component. Then the next one is the drug metabolism. So drug metabolism, it consists of the knowing about the phase 1 and phase 2 drug metabolism, like oxidation, reduction, hydrolysis, all the phase 1 pathways, and conjugation pathways of phase 2, glucuronide conjugation, glutathione, sulfates, sulfathione. So all the conjugation pathways of the phase 2. Okay, and this part, that is the drug metabolism, it plays a major role. Like they may ask you the question in chemistry, okay, and also they will ask the questions in biopharmaceutics, which will be in the paper 2. So this drug metabolism, there is the phase 1, phase 2 drug metabolisms, everything that they ask in the chemistry part, as well as you may also expect it in biopharmaceutics. Okay. Then the most important one, the next one, is about the stereochemistry. So stereochemistry is important because definitely you will get 1 or 2 questions from stereochemistry in your final paper. Okay, so 1 or 2 questions where you need to know about all the isomers, geometrical isomers, enantiomers, diastereomers, and so on. So everything that you need to study in the stereochemistry part. Then few other parts like physical chemistry and analytical biochemistry part, okay, and some other important topics like saponification, esterification, polymerization, and so on. So all these things that you need to study for your KAPS examination only for paper 1, and that too for chemistry component. Okay, but don't, by looking at this syllabus, so this is the official syllabus from the website of the APC. Okay, so don't be scared, okay, because I will make the chemistry as simple as possible. Okay, so that like within just I will take 4 lectures on chemistry, that as I have been doing for the last batches. Okay, so I will take only 4 lectures, like each lecture will be 2 hours. Okay, so I will take only 4 lectures, and within 4 lectures I will cover the whole chemistry part. Okay, so that is what is required for the KAPS examination. Okay, the essential parts which are required for the KAPS examination. So those things will be covered in 4 lectures, within 4 lectures. So you will learn everything. You will learn from organic chemistry to, you will learn from the minor topics like saponification, esterification, and polymerization, and so on. Okay, and everything that you will get perfect within the 4 lectures. After finishing the 4 lectures, there will be some revisions as well. Okay, and based on your efforts, okay, so you will get perfect within few days in chemistry component. So I know that most of the candidates, those who are appearing for KAPS examination, they will be worried, especially with chemistry. Okay, and some of them will be worried with calculations. Okay, but don't worry, these 2 parts we will make as simple as possible, okay, in such a way that you will never forget in your life. Even after finishing the KAPS examination, for at least for 3 or 4 years, you will never forget all those concepts. Okay, so that's my challenge. I will make it as simple as possible for you guys. Okay. Then the next part of paper 1 is physiology and pharmacology. So in physiology and pharmacology, as I mentioned, that it carries around 70% of weightage. Like out of 100 questions, you can expect up to 70 questions only from physiology and pharmacology. And especially in physiology part, out of 70, roughly around 20 questions will be from physiology part. Okay, and the remaining part, all the remaining questions will be from pharmacology component. Like you can expect up to 50 questions from pharmacology, and 20 from physiology, and 30 from chemistry. Okay, so in this way, in paper 1, they will divide the questions for chemistry part, physiology, and pharmacology part. So in physiology, sometimes they may ask you the simple definitions. Okay, and sometimes they will ask you some complicated pathophysiology related questions. Okay, so there will be a mixed type of questions. For example, if there are 20 questions, so 6 or 8 questions will be some simple questions, okay, but the remaining 12 questions will be a bit pathophysiology related questions, okay, a bit complicated questions. And physiology part, as I mentioned, that you can expect up to 20%, like 20 questions from physiology component. Then the most important one, the next part, is the pharmacology part that plays a major role in paper 1. So here, pharmacology, you can expect up to 50 questions from pharmacology, okay, and especially at the end of the pharmacology part, at the end of the paper 1, okay, you can expect one case scenario, one case study. Okay, so the case study followed by 5 questions, and all the cases, like the case that you get in paper 1 will be quite simple, and all the questions will be pharmacology related questions. So they are not therapeutic related questions. They are just the pharmacology, basic pharmacology related questions. And in our lectures, in our class, we'll do a lot of cases, okay, where you will learn more about how the cases it will be. Okay. And in pharmacology part, they will ask you about the biochemical pharmacology, systemic pharmacology, like the mechanism of action, receptor theory, okay, and pharmacology of all the systems, like respiratory system, cardiovascular system, nervous system, endocrine system, GI, and so on. So pharmacology of all the systems, where you need to study about all the drug classifications as well as their mechanism of action and side effects. Okay. So the whole pharmacology part, including the chemotherapy, like antimicrobials, antibacterials, antivirals, antifungals, antiprotozoals, okay, and anti-cancers agents. So everything that you need to study in pharmacology part. Okay. And finally, there will be a toxicology component as well, like side effects, toxicity, and mechanism of toxicity, and so on. So this toxicology part, it plays a major role in paper 1 and paper 2 as well. Okay. So you may expect the questions in paper 1 and paper 2 as well. And even for the pharmacology, that whatever the pharmacology that we study, okay, the same thing, it will be helpful in paper 2 as well. Okay, because paper 2 is nothing but applied therapeutics. So if you are perfect in pharmacology, then easily you can answer the questions of therapeutics. Okay. So these are the components that you will see in paper 1. Okay. Then next one. Then coming to the paper 2. In paper 2, the 2 main components are, one is the pharmaceutics and the other one is the therapeutics. Okay. So pharmaceutics, it carries around 30% of weightage. Like 30% of the questions in paper 2 will be from pharmaceutics. Again, paper 2, it consists of total 100 MCQs, okay, and 120 minutes will be the time provided. And out of 120 minutes, you need to answer 100 MCQs. Okay. And out of 100 MCQs for pharmaceutics, there will be around 30% weightage. It means that you can expect 30% of the questions from pharmaceutics. So here, pharmaceutics in the sense, there will be different components in the pharmaceutics that we'll see in the next upcoming slide. Okay. And the next part, the major part, is therapeutics. Okay. So there is applied therapeutics, which carries around 70% weightage. That is 70% of the questions from therapeutics component. Now let's have a look through what are the subtypes or what are the subcomponents that we can see in case of pharmaceutics and therapeutics. So in case of pharmaceutics, the first one is the pharmaceutical technology based question, or we can say it as the physical pharmacy. Okay. So from physical pharmacy, you can expect only 4 or 5 questions or up to 6 questions in your final examination. Okay. So these physical pharmacy questions are nothing but the questions related to the tablets, capsules, emulsions, suspensions, syrups, and so on. Okay. Suppositories. Okay. So all these things that what we have learned in our pharmaceutical technology or in the physical pharmacy. So that is the one of the components which comes under pharmaceutics, and it carries only a small weightage. That is only, it will carry 4 or 5 questions, only 4 or 5 questions that you can expect. Then the next one, and the major one and the challenging one, is calculations. Okay. Calculations plays a major role in paper 2, especially to pass this pharmaceutics. Okay. If you are perfect in calculations, then the chances, the probability to pass the whole paper will be much easier. Okay. Then later on in the next upcoming slide, I will explain you how much percentage that you need to get in each paper and that too in each component. Okay. But in pharmaceutics, you will also expect the calculations. So there will be calculations in pharmaceutics. Okay. So the calculations in the pharmaceutics will be like, they are the simple calculations. Sometimes they may ask the simple calculations. Okay. And sometimes there will be a bit complicated calculations. Okay. Like the drug clearance, volume of distribution, and calculation based on the Henderson-Hasselbalch equation, that is the pH equals to pKa plus log so and so. So such type of the calculations will be there in pharmaceutics. Okay. Then the next part in pharmaceutics is the biopharmaceutics. So biopharmaceutics also plays a major role here, because you can expect a lot of questions from biopharmaceutics, like around 8 to 10 questions from biopharmaceutics. Okay. So out of 30, okay, at least there will be 10 questions, or sometimes up to 15 questions from biopharmaceutics. Okay. So biopharmaceutics plays a major role to pass the paper 2. Okay. So pharmaceutical calculations and biopharmaceutics, they both are much important to pass the pharmaceutics component of paper 2. Then the next one is microbiology. So from microbiology, you may not expect much questions, but at least 2 questions. Definitely there will be 2 questions from microbiology. And the next one is the immunology. From immunology, definitely there will be 1 or 2 questions from immunology part as well, like including the vaccines, autoimmune disorders, and so on. Okay. So you will expect, like, definitely there will be 2 questions from immunology component. Okay. So these are the subcomponents that we can see in case of pharmaceutics. Okay. And all together they cover 30% weightage. Okay. Like 30% of the questions will be from all these components. Okay. Like in paper 2, you can expect, like, out of 100, 30 questions will be from pharmaceutical technology, calculations, biopharmaceutics, microbiology, and immunology. All together will be 30 questions. Then after that, the next part in paper 2, the major part is therapeutics, that is the applied pharmacotherapeutics. And from this therapeutics, the rest of the questions, up to 70 questions, all the questions will be from therapeutics. And in therapeutics, again, you can see some calculations. So calculations here, we can divide the calculations into 2 parts. One is the pharmaceutical calculations, that is the pharmaceutics calculations, and the other one is the therapeutics calculations. Okay. For example, in your final examination, definitely there will be 12 calculations. Okay. Out of 12 calculations, how they divide is, so at least there will be 6 calculations from therapeutics, okay, and 6 calculations from pharmaceutics. Okay. So pharmaceutics calculations are nothing but the half-life, shelf life, drug clearance, volume of distribution, and so on. Such a big or the complicated calculations will come under pharmaceutics calculations. But in therapeutics calculations, all they are the posology related calculations, like dilutions, percentage, or the what is the dose for the child. Okay, they will give the body weight, and we need to calculate the dose for the given patient. Isotonicity, okay, proportions. So all these simple ones, they come under therapeutics calculations. Then after calculations in therapeutics, the next one is the posology part, that is the dose regimens for common medications. Then the drug of choice, like they will give you a question and they will ask you that, okay, in this scenario, what is the drug? What is the most appropriate drug for this for a given condition? Okay. Then ADRs, there will be a lot of questions on the adverse drug reactions as well as the side effects, and there will be questions related to the patient counseling. So what counseling points that we need to provide for thrush medications? So what counseling points that we need to provide for antidiarrheal medications? So in that way, at least you can get 3 or 4 questions only from counseling part. And then the next part is the drug interactions. It plays a major role again in paper 2. At least you can expect 4 or 5 questions from drug interactions part. Okay. And then the drug information, which is not much important, like they won't ask much questions, but you can expect only 1 question. And the other one, the last one, is the over-the-counter products. Okay, so at least you can get around 2, sometimes 3 or 4 questions on over-the-counter treatments, like head lice, for management for the head lice, okay, and management for other simple conditions, okay, like primary healthcare issues. So all those things, it will be covered under therapeutics. Okay. So in this way, in therapeutics, all these are the subcomponents from which you will get total 70% weightage. That is 70 questions in paper 2 will be from therapeutics. And this therapeutics, it plays a major role in passing the paper 2. Okay. So not only therapeutics, even pharmaceutics plays a major role. Okay. And even in paper 1, pharmacology plays a major role, physiology plays a major role, and chemistry plays a major role. Okay. So the main challenge with this KAPS examination is, okay, so I will explain you how the questions it will be and how much percentage that you need to get in order to pass the KAPS examination. Okay. So now let's have a look through the exam passing score. Okay. So here in paper 1, as I clearly mentioned that for pharmaceutical chemistry, there will be 30% weightage. And for physiology and pharmacology component, there will be 70% weightage. Okay. That is roughly, you can expect 30 questions out of 100 from chemistry and 70 questions out of 100 from physiology and pharmacology part. Okay. Now, the main challenge in KAPS examination is, okay, out of 30 questions, that is 30%, okay, you need to score 50% in chemistry. Okay, 50% in chemistry. For example, if there are 30 questions, definitely you must get 15 correct answers out of 30. Okay. Even if you get 14, it means that you are unsuccessful in chemistry component. If you are unsuccessful in chemistry component, it means that you are unsuccessful in paper 1. Okay. Even if you lose in one of the components, okay, you will lose the whole paper. The same goes with the physiology and pharmacology. There are 70% weightage. It carries 70 questions. So out of 70, you need to get 50% correct. That is 35 correct answers. Even if you get up to 34, and if you lose with one question, then you are unsuccessful in this part. If you are unsuccessful in this part, it means that you are unsuccessful in complete paper 1. If you are unsuccessful in paper 1, it means that you need to repeat the paper 1 again. Okay, so you need to repeat the complete paper 1 again. It doesn't matter even if you have passed the chemistry part, just you have failed in the physiology and pharmacology part, it doesn't matter. Again, you need to sit for the whole paper. That is, you need to repeat the complete paper 1. Okay, so this is the main challenge with KAPS examination. Okay. So here, in order to pass the paper 1, so you need to score 50% in chemistry and also 50% in physiology and pharmacology. Okay. But if you score up to 48% or 49% in chemistry, but in physiology and pharmacology, let's say, for example, if a candidate has scored up to 80% in physiology and pharmacology, because they love this subject, okay, they are experts in pharmacology and physiology, and they have scored up to 80%. But they have scored only up to 48 or 49% in chemistry. Okay. There is no use at all. Okay, so there is no use at all. It means that still they are unsuccessful in paper 1. Okay, and they need to repeat the whole part again, the whole paper once again. Okay, so but if you score 50% and 50% in both the components, then you will be considered as successful in paper 1. Then the same goes with the paper 2 as well. So in paper 2, we will be having two components. One is the pharmaceutics part, and the other one is the pharmacotherapeutics. For pharmaceutics, it carries the weightage of 30%, and therapeutics, it carries the weightage of 70%. It means that roughly you can expect 30 questions out of 100 from pharmaceutics and 70 questions out of 100 from therapeutics. Again, once again, the same challenge. So out of 30, you need to get 15 correct answers. Okay, so you need to get 15 correct answers, and here out of 70, you need to get 35 correct answers. Even if you get up to 14, it means that you will lose the pharmaceutics part. When you lose the pharmaceutics part, it means that you will lose the whole paper 2. You need to repeat the paper 2 once again. Okay, so the same challenge with the paper 2 as well. Need to get 50% in pharmaceutics and 50% in therapeutics. Then only you will be considered as successful in paper 2. Okay. Otherwise, you need to repeat the paper 2 once again. Okay. So if you are successful in both the paper 1 and paper 2, then finally you will get your final result as you are successful and you have passed the KAPS examination. Okay. So they will give you that you have successfully passed the paper 1 and you have successfully passed the paper 2, and overall result is pass. But if you are unsuccessful only in chemistry part, okay, and you have done all the other parts well, okay, that is you have you are success in pharmaceutics part, you are success in therapeutics part, that is you have cleared the paper 2, and in paper 1 you have successfully cleared the physiology and pharmacology part, but you have lost only in chemistry component. Okay, it means that here they will show that you are unsuccessful in paper 1, okay, and overall result is unsuccessful. It means that you need to repeat the paper 1 once again. Okay. And the interesting thing, it is not interesting, but it is a painful thing, is that for the KAPS examination fee, as you guys know that you need to pay $2,300, roughly $2,300 to APC for the KAPS examination. And this fee is for both the papers, that is paper 1 and paper 2. For the first time, you will pay $2,300 to sit for this examination. Okay, but if you are unsuccessful only in one part and you have lost this paper 1, okay, it means that you need to sit only for paper 1. Okay, even if you are sitting only for paper 1, it doesn't matter. Still, you need to pay the full fees to APC. That is, still again you need to pay $2,300 to APC to sit for just for one paper, which is highly painful thing. Okay, so that's why when you are preparing, okay, make sure that you need to focus on all the components. Okay, you need to focus on all the components. Okay, don't just stick on only for one component. Just don't stick on with pharmacology part. Okay, so focus on chemistry part as well. Make sure that at least you get 50% in chemistry, and at least you get 50% in pharmacology, 50% in pharmaceutics, and 50% in therapeutics. And the other thing, like most of the students, they have asked me in previously that as in paper 1, especially in physiology and pharmacology, which carries 70% of the weightage. Okay, for physiology, roughly around 20 questions, and for pharmacology, there will be 50 questions. Okay, so here again they won't assess in individual component. Okay, overall, like combining both the physiology and pharmacology, you need to get 50%. Okay, so you need not to get 50% in physiology and 50% in pharmacology. Okay, so overall combined physiology and pharmacology, okay, out of 70 questions, you need to get 35 correct answers. Okay, then you will be considered as you are successful in that component. Okay. And again, even in chemistry, they won't assess in individual components. Okay. Overall, from all the questions, you need to get 50%. Okay. The same goes with the paper 2 as well. In all together, from microbiology, from immunology, calculations, biopharmaceutics, and technology-based questions, all together, you need to get 50%. Okay, they won't assess like how many answers that you have, or how many correct calculations that you have done, and how many you have lost in biopharmaceutics. So such things they won't calculate again. So overall together, you need to get 50% in pharmaceutics. Okay, so in this way, they assess you in the examination, and this is the passing score in paper 1 as well as in paper 2. Okay, so once you clear all these components, then you are considered as successful in both the papers. Okay, so finally, the references that we follow to teach at Elite Expertise, okay, and all the components and all the lecture slides that we prepare by referring all the standard books. Okay, so we mainly prepare our content based on our practice. Okay, because in KAPS examination, that is the most important one. They expect you to know about Australian practice. Okay, so that's why they are screening all the overseas candidates by conducting this examination, that is the KAPS examination. So they expect you to have the minimum standards that is equal to that of the Australian graduates. Okay, so the most important thing is in KAPS examination, the questions that they ask is based on the practice, okay, how Australian pharmacists they are practicing, okay, and they expect that the overseas pharmacists they should have this basic knowledge. Okay, so that's why we prepare all our content based on our practice. Okay, so how we are practicing in the hospital, what are the new things that we are coming across. So every time that we keep on updating our content, we keep on changing our slides. Okay, so that is the most important one, because it plays a major role in clearing this KAPS examination. Like even how hard you guys keep on studying by sitting at home without having this clinical exposure, okay, so you will never, it becomes a big challenge to clear this KAPS examination. And the other thing is that, as everyone know, that it is a vast syllabus. Okay, if you keep on preparing by yourself, you keep on doing a self-study, it takes ages to clear this KAPS examination. Okay, so that's why all the content that we design is mainly based on our practical experience. And we mainly use the Australian Medicine Handbook, AMH, which is considered as the gold standard in Australia. Okay, for everything, all the pharmacists, doctors, and everyone, all the healthcare professionals, they refer Australian Medicine Handbook, which is a gold standard in Australia. And we prepare all our content based on AMH. Okay, and we prepare the content based on the therapeutic guidelines, that is the Australian therapeutic guidelines. So what are the clinical guidelines that are available? So based on those things, we prepare our content, because in KAPS examination, they expect mainly for the candidates to know about what is the current scenario, how we are treating the patients in Australia. So if there is a particular condition, okay, then what treatment is to be given to the patient. Okay? So that's what they expect, especially in therapeutics part. In the therapeutics component, they expect a lot from your clinical knowledge. Okay, so that's why we use the therapeutic guidelines, which is also one of the standard one, and all the doctors and some of the especially hospital pharmacists, the clinical pharmacists, they use these therapeutic guidelines in Australia. Okay, and also apart from that, we use the UpToDate, which has an like it is a ocean full of knowledge. Okay, so it gives an up-to-date information regarding each disorder or each condition. And also we use some standard pharmacology textbooks to prepare our content, like Goodman-Gilman, Rangenthal, and also we follow the Coda Campbell. So all these are the standard books that we follow to prepare our content. So now the final thing, the take-home point is, when we have prepared our content by referring all the standards, okay, so it means that you need not to worry about opening any other textbooks. Okay, so just if you follow our classes, if you follow our lectures, and if you follow whatever the information that we have provided in the handouts, okay, and if you follow and do all our mocks, okay, and assignments, okay, so that is more than enough for you to clear this KAPS examination. You need not to open any book. Okay? You need not to go and open Lippincott or Sharjeel or any other textbooks, okay? Because we prepare our content by referring all those standard books. Okay, so you need not to worry about opening other books. So just whatever be the information that we provide to you, whatever be the handouts that we provide, whatever be the lectures that we provide, the mocks that we provide, so those things are much more than enough for you to clear this KAPS examination. Okay, so these are the references that we use for our lecture content. Then here are some strategies for preparation, and I will quickly go through the strategies. Okay, so the first one is try to attend the live lectures. So we always, all the lectures that we conduct, we take are live lectures. Okay, so here in KAPS examination, like at Elite Expertise, so myself and ma'am, we both will take the lectures to you. And we both, as you know, that we are clinical pharmacists in Australia, and we have been practicing for 6 years in Australia, and we have been trained more than 500 students in clearing this KAPS examination. Okay, so we try to make all the syllabus, all the content in a comprehensive way and try to explain it to you. Okay, so always try to attend the live lectures. Okay? But I know that most of you are from different parts of the world. Some of you are in Canada, US, UK, and so on. Okay, and it might not be possible for you to attend all the live lectures, but try at least try to attend 2 or 3 lectures in the week, okay, especially during the sessions. So try to attend the live lectures, so that if you have any questions, then straight away, once after finishing the lecture, you can ask to us. Okay, so that's why always I encourage all the candidates to at least once or twice a week try to attend the live lectures. Okay, so that we keep on tracking your progress. We keep on I'll just keep on checking that how many how many hours that you are spending in a week, okay, and also how many mocks you have done, and what are the current like study plan and so on. So everything that I will try to cover the base. Okay, then we also have some pre-learning modules, okay, like before the live lecture. For some of the topics, we'll provide you a live streaming. Okay, so you need to attend those lectures as well, the live stream lectures, and the next day you will be having the live lecture. And during that live lecture, so we will discuss about all those things that you have learned, the important points, and we'll discuss if there are any case scenarios. Then we will discuss with the case scenarios, and we'll do some the live lectures. Then the next one is, whenever we give you the assignments, okay, there is no any exemptions. Okay, so no exemptions. Whenever there is a deadline, you need to finish the assignment and try to submit it before your deadline. Okay, so you must be on time. Like, you should never neglect submitting the assignments. Okay, so it's a strict rule. As you have started your journey, so you have got like 4 months, 3.5 months, okay, for your March exam. Okay, so for all this 3.5 months, you need to you need to give a full dedication only towards preparing this KAPS examination. And also you need to do the mocks and grant test as many times as possible. And we will share you a template that I have prepared for entering your scores that you have that you will get for the mocks. So for each mock, like, what you need to do is, once you do your mock 1, okay, so if you have done your mock 1, just you will enter the today's date, that is 25th of November, and you will you need to enter that what is your percentage that you have got in your mock 1. So today is your first attempt in mock 1. Okay, so you will enter the percentage up over there. Then after 2 weeks, you need to repeat the same mock. Then again, you need to enter the score in your score sheet. Then you will do the mock 2, mock 3, mock 4, and the target is you need to finish all the mocks. Like, there are around 14 mocks, 14 plus. Like recently we have added another one. Okay, 15 or 16 mocks. So the target is you need to finish all the mocks for at least 10 times. That is, each mock 10 times before you sit for your examination. Okay, and for each mock, you need to, and each time when you do the mock, when you repeat the mock, you need to enter your percentage. That is, what is your score that you have gained for each test, in each test. Okay, and once you upload, once you enter those scores, and you need to keep on uploading in the drive, and I will go through all your scores. Okay, and one of us will check all your scores, and we'll check your progress. Okay, and I will keep on tracking your progress. Then quickly refer to the information that we provide in the handouts. Okay, so handouts are the best ways to quickly go through them, and there will be some important points which might not be in the handouts, but we still cover in the lectures. Okay, so for those important points, immediately you need to note it down in your handouts. Okay, and as I mentioned at the beginning itself, there will be some team push activities. Like, we'll put you in 4 different groups, okay? And you need to submit your assignments on time. And in case if you fail to submit the assignments, then all the other team members will push you. Like, they will keep on texting you, they will keep on sending the messages to submit it as soon as possible. Because if you won't submit, the other candidates, they can't submit, because it is a group submission. So because of one candidate, the whole team, they can't submit it. So that's why it is mainly this activity that I have introduced is mainly for those who are a bit lazy. Okay, so for them to push, there will be the other members. Okay, all the other team members, they will always, they will keep on pushing and make sure that they finish their assignments and they finish their mocks and they finish entering the keywords and so on time, and they submit it to us. Okay, so these are the strategies, guys, that we are going to follow for the March examination. And all the best, like as you have been a part of our Elite Expertise team, and it is my promise that I will make sure everyone will pass this examination in your first attempt. Okay. Okay, so I guess it's better we can end this session. Okay. Thank you so much. Thanks for joining once again. Okay, and I hope your journey goes well, and you all will clear the KAPS examination, and you will get, definitely you will get the visa, and one day you will migrate to Australia and you will start doing your internship, and after internship you will definitely one day you will become a fully licensed pharmacist. Okay,